Hello there. How are you feeling today? I am doing well, thank you for asking. My name is Caitlin, and I'm going to be working with you today through your cranial nerve examination. So before we begin, can you just confirm for me your last name and additionally confirm your date of birth? Okay. Excellent. Is this your first experience with a cranial nerve examination? That's not a problem. So I'll break a cranial nerve examination down for you a bit. It looks very complex on paper, but I promise it is simplified. Let me show you this little cheat sheet that I have. On this listing, you'll see all the different nerve names as well as their traditional medical terminology. To simplify things, we're just looking at the optic nerve, the olfactory nerve, the facial nerve. I will additionally test your hearing as well as just checking the muscles from the shoulder region up, essentially. Does that all sound good? Excellent. So let's kick it off. I am going to begin with the eyes. So if you just give me one moment, I'm going to put on a pair of gloves. We'll spend a good amount of time checking the optic nerve. There's a few different tests that we're going to work through. The first test is going to be a follow the finger exercise. So I'll take a finger or two on either hand, and I will begin to motion up, down, side to side. And I just need to watch your eyes. So just watch as it wiggles. And continue to look. Continue to use your eyes. Very good. Now, let's get a little bit closer now, just to see how your eyes dilate. If I get close. Very good. Alright, I'm going to take a quick step back and just watch your eyes as I move my and up. Alright, very good. Very good. How are the eyes feeling? Good, I'm glad they're not too tired. So, while I have you here, I'm going to do a blind spot test. So, I'm going to take a step back and I'm going to ask you to look directly at my face, the bridge of my nose to be exact. And I'm going to pull apart my fingers until you can no longer see them. And I just need you to indicate when you're no longer seeing my fingers, okay? in. Tell me when you see them. Very good. Excellent. Let me just mark this. Okay. Excellent. All right. So let's move on to some charts. This is just your standard eye examination chart. You could just read the line that I point to. Let's hold this in place for you. And let's start with 2. Okay. What about 3? All right. 4. Last one. 7. Very good. Now to continue with this chart, if you could just take your hand and place it over one eye, whichever, and then we'll continue with the eye chart, and we'll switch and have you cover the other side. Okay? Yep. Awesome. So now that that side's covered, can you read 3 for me? What about 5? 7? Very good. Alright, you can switch sides. And the 3rd line for me. The 6th. Okay. And lastly, can you read the 8th line? Very good. You did very well with that. So, let me just put that aside for now. Let's give your eyes a brief moment of rest, and I'll fill you in on the next portion of the examination. This next portion, I'm going to be using a flashlight, and I'm going to have you just look into the light, checking the dilation, as well as having you follow the light briefly. Okay? Excellent. So first, I'm just going to take a peek at your eye's reaction to light. If you could just look beyond me at this point. Perfect. And let's get really close on this side and just check. Okay. Yeah, so your eyes are reacting well to the light. Let me just get close and pull back and see what happens. Okay. Alright, very good. So with that being said, your pupils are dilating just how we want them to. I'm going to continue now with having you follow this light. I'll be watching your eyes, and we're just going to do slow movements. Nothing too quick, nothing too fast-paced. your eyes are responding well. Let's see across. Very good. All right. How do your eyes feel after that? Like they need a moment? I understand. So, how about we go through some soothing eye exercises? Rapid blinking, as such. Yes. So just blink excessively. Very good. Yeah, keep blinking. Great. You can stop. And now, once your eyes are feeling a little back to normal, if you could just look this way for me. How about that way for me? Up, down. How about diagonal this way? And diagonal down. Very good. Just really, really quick. If you could just look up and stay. Hold it. Good. Okay. You could just look down. Okay. Okay. Very good. I think that is everything with your eyes. How are they feeling? A little worn out? I understand. So, next we're going to move on to your olfactory nerve. The optic nerve looked great, so let's work our way down the face. So, have you noticed any changes with your sense of smell lately? Or have you noticed any changes with your sense of taste? All right, good to know. Now, on your client information sheet, you did disclose that you have no food allergies that we need to be concerned about at this moment. So you are opting in to a taste portion. All right. So let's get started on the olfactory nerve and then we'll do the taste portion. Now I have 3 different scents for you to identify. I have them right in front of me, no peeking. You could shut your eyes and give this a smell for me. Okay. You can waft it like that. Yes, perfect. Good. It is very sweet smelling, but it does have that little spice. You are correct. It is cinnamon sugar. Yes. Alright, no peeking. Here's the second smell for you. Alright. Any guesses? Of course, it's honey. Honey's only one of the best smells in the world. Your last one. It's a bit of a smaller portion than the other 2. We do this because the smell is so strong. We need to make it a bit of a challenge. Any guesses what this is? Yes, it is vanilla extract. It's very rich. So, great job. I am going to quickly just peek up your nostrils if you don't mind. Just ensuring everything looks okay. Okay, very good. There's no blockages, nothing of concern. So for the taste portion, I just have a cough drop for you. There you are. You can take it out of the packaging and let me know if you're able to taste anything. I'm looking specifically for flavor notes. Yes. Very good. Yes. Great job. All right. Any questions or concerns involving the olfactory nerve? Very good. Let me just take a quick note of the olfactory nerve portion. Alright, so while I have you, I'm just going to take a peek at the facial muscles now and the facial nerve. So at this point, I do have to ask your permission if I may touch you. Great. So nothing too invasive, just kind of feeling around the area of the face. Most importantly, we're looking for anything that shouldn't be there. Bumps, bruises, inflammation. Just stay right there for a moment as I check your temple. Okay. And I'm just going to grab the back of the neck. And pardon my reach. There we go. Very good. Just around the top of the head and the ears in a moment. And let's check the ears. All right. No bumps, no discomfort. I'm just going to quickly tug on the ears. Alright, so no pain. Very good. It's exactly what we want to hear. Excellent. So I didn't see any facial asymmetry and no concerns, so I think that we are good to move on to some muscle tests at this time. This is sort of the fun portion of the exam. I'm just going to be testing your reactions, essentially. So if you could look me right on, give me a big smile. Now, can you press your lips together like you're going to whistle? Good. Can you raise your eyebrows? Okay. Can you make a scrunchy, angry face? Okay. And can you stick out your tongue? And leave it right there for me. Okay. And can you put your tongue back? Bring it back out and say, ah. Okay. Good. Now I'm just going to feel the lymph nodes around the neck. If you don't mind, just going to feel around for inflammation in particular. And you haven't reported a sore throat in a while, correct? Okay, good. Just checking the symptoms. Good. Lymph nodes feel healthy. And yeah, excellent. Now, when I was pressing on your face, you didn't seem to react in a painful manner. Is it safe to say that your sinuses are in control and not inflamed? Excellent, that's what I thought, but just wanted to confirm before we move on. Alright, in addition to having you make fun facial expressions, I'm also going to have you do some fun movements. This next one is just shrugging your shoulders up and down just a few times. Good. Very good. Now, I want you to continue to hold your shoulders up, and I'm going to push down on those shoulders. And I want you to resist me pushing down. Okay. Keep resisting. Keep resisting. Good. Alright. Excellent job. Last one that's fun. I would like for you to follow along with my directions. So I'm going to hold up a finger, and I am going to have you touch my finger, touch your nose. So if you could follow along. Can you touch my finger? Can you touch your nose? Can you touch my finger? Can you touch your nose? Finger, nose, finger, nose, finger, nose. Good job. Yeah, the muscle tests are typically the ones that are most fun, so thank you for being a good sport. We are at our final portion of the examination today. I am going to be testing your sense of hearing. So I'm just quickly going to take a peek at the ears. You already told me there was no discomfort when I pulled on them, correct? Okay, good. So let's just look inside and see. And I don't see anything of concern. Let's get the light, just check in the ear. And the other side now. Okay. And let's get the light on in there. And no, nothing of concern in your ears. No pain. Excellent. Now let's test your sense of hearing. I am going to softly whisper a series of numbers from varying positions in the room. If you could just reiterate the numbers that I said aloud, okay? 10, 24, maybe 7, 4. Very good. Alright, now the last portion, I'm just going to make the sound of a sound bowl sing. Typically, tuning forks as well as sound bowls are used to create a frequency and vibration for you to listen to. So, I'm going to let it sing and you just let me know if you're able to hear the tone. Very good. It's very subtle, isn't it? Let's do 2 more tests. Very good. So you were able to hear those tones. Excellent. All right. So, everything on the examination was a success. I had no concerns. The only thing is, I just wanted to know what were your thoughts on the cough drop. They're tasty, I know, I agree. Excellent. No, you did very well today. Did you have any questions for me regarding results or any of my final thoughts? Yeah, of course. So, your concern was about the eye charts? Yeah, that's not a problem. If you'd like, I am able to reach out and refer you to a specialist. Maybe you could go get an eye examination soon. If that was the portion you think you struggled with the most, then I feel confident in reaching out to the referral and getting you set up and on track for an eye exam in the near future. Not a problem. Alright, so I will walk you out whenever you're ready, and I can get you that referral sent over immediately. Oh, no problem. Thank you.